We have more toxins that are in toys, for example, to foods, to sippy cups that we drink out of. All of that exposure has increased over time, just as much as it's been passed down through us, just as much as we're reducing nutrients in soil that we're growing our food in.
Toxins are everywhere. From the disinfectants at the gym, the cups we drink from, the air we breathe, it's just unavoidable. Studies show that over 90% of people have detectable levels of herbicides like glyphosate in their body. Chronic exposure to things like heavy metals, microplastics, pharmaceuticals, it's pushing us over the edge. Our bodies are communicating that they've had enough, be it skin issues, autoimmune diseases, hormone imbalance, constant infections. It's time to dig into the role toxins play in disease. This season's all about understanding why our toxic loads are tipping and how to take practical steps to support your body's natural detoxification pathways and learn how to reduce toxins in your everyday life.
What's up, Roots and Fruits community? Today I'm joined by the lovely Dr. Hilary Dinning. She's a Calgary-based naturopathic doctor who specializes in pediatrics, and she has a special focus also in ADHD and autism. And so today we're going to dive into that and a bit of the connection with toxicity. Super excited for this conversation. Welcome to the show, Dr. Hilary.
Thank you so much. I'm happy to be here with you.
Happy to be chatting as well. I'm really excited. And the first question I always ask people, I feel kind of bad because how can we sum up our complex and beautiful journeys into a few minutes? But I'm going to ask it anyway. How did you get into doing what you're doing now?
Oh my gosh. Naturopathic medicine in general. I was in university and was experiencing chronic pain that I wished that the two sides of medicine would chat, meaning, and I shouldn't maybe probably say two sides, right? There's so many yet, that alternative care, if I can group so much of that into one, and Western medicine. And because I was seeing so many different practitioners, I really wanted the two to chat. Fast forward, gosh, it was maybe 10 years. And then I went back to school after my undergrad and thought to myself, okay, I'm gonna jump in here, and ended up on my path in naturopathic medicine. And then specifically into pediatric care. Gosh, that was right from the very beginning. I did a focus in my clinical rounds in my fourth year in children's care. And I thought, you know what? And I explain this sometimes and I'm like, that sounds like too kind of, hopeful or too big. However, I feel like that if we can support children in their health from the very beginning, whether it be days old to only, a few years old, that one healthy child at a time will change so much of our trajectory with respect to everything from mental health to emotional to physical health, and change the world one little healthy child at a time. So it's I feel like that sounds really big, yet that's really actually the very sort of root of my passion in the area.
That's beautiful. And it is really big. And that's the point. Like if one kid's life trajectory is changed because of, you've given them some of the foundations of how to care for their bodies from a young age, then that is the biggest thing that you could give a family. So I appreciate it. And I mean, personally, I appreciate it because you've worked with us too. And I love it. So that's a really cool journey. And then in terms of the autism spectrum, ADHD, how does that kind of fit into your journey? What piqued your interest there?
Yeah, actually, and it's funny, even just talking about this is so interesting to reflect on where you've been and how how my practice has developed over time. And I feel like what's happened there was twofold. One, I feel like patients, people find you as much as you find people. And I feel like that, a lot of autism showed up on my doorstep, and I was so fascinated by it. I was so fascinated by it because it's so multi-layered. And that's part of naturopathic medicine in general. And I think that's what, when you think about naturopathic medicine, you're always focusing in on the whole person, right?
Mm.
And with autism, with ADHD, if we can almost kind of umbrella that under neurodivergence, we've got a lot of different factors or layers to health that we want to address. And I think that puzzle, if I can call it, and really supporting the different systems and prioritizing one over the other at the beginning, and how it flows throughout treatment, really was now, and even now, what really attracts me to working with families with neurodivergent kids.
I feel like the conversation around neurodivergence, it has only gotten louder in society, right? Like we're talking about it more, which is awesome. I would love to. This whole season of the podcast is about toxicity, which is why I wanted to have you on and talk about that link, because I think there's a lot of great tools out there for people who are kind of delving into that topic. But I mean, on Instagram or whatever, right? People are getting little sound bites here and there, and to contribute to that and from maybe a perspective that might be lacking in people's feeds around kind of the connection between toxicity and different elements within neurodivergence. So I'm not too sure if the links with toxicity in autism and ADHD are similar, or what that looks like. That's where you're here for. So can you kind of talk about the difference between the two, and then in terms of how toxins are intertwined with those?
Yeah. So what I would say, I mean, in terms of the difference between ADHD, for example, and autism, they're very clearly or obviously different diagnoses, right? Attention deficit, hyperactive, and there's multiple sort of subtypes of that. I would say with autism is more of a social reciprocity, excuse me, and has this autism spectrum disorder is a massive spectrum. So I feel like there's a lot of different innuendos within that. So obviously those two are different. However, where I would say that they join is, and like I say, sort of the umbrella of neurodivergence, yet those two diagnoses fit under the umbrella of neuroinflammation, neuroinflammatory issues in the body. And when I explore, so I mean, just to explain that a little bit, and how I sort of think about this is that when I say neuroinflammation, I think about literally like grade 6 science, like, or grade 9 biology, like those neurons, are they being formed properly? Then I think about the messages along the neurons and what those look like, meaning neurotransmitters. And are they being produced properly? What do they look like? What messages are they? Are they balanced, meaning excitatory and inhibitory? So all of that is what I'm talking about in terms of neuroinflammation. Those are not working properly. And then where naturopathic medicine falls into play, and where toxicity falls into play, is we want to understand the root of it. We want to understand why that's happening. And toxicity, being a massive topic, I understand, falls into one of those root causes of that neuroinflammation. Does that make sense?
Absolutely. Like in terms of maybe triggering inflammation, right? You're saying that toxins would be part of that process potentially as a factor. Yeah.
Yeah.
Yeah. And so can you kind of dive into what you've seen, I guess, in terms of the prevalence of increasing toxic loads in our environment, as well as increasing, people on the spectrum? Now, I understand that it's such a multifactorial thing. I'm not saying it's 100% toxins, but can you explain that connection and the prevalence? Like, is there, is it that we're diagnosing it more, or is it that there's more toxins? Does that
Oh my
make sense?
gosh, I know.
Yeah.
I think there's so, and you know what, I've heard myself say this twice now, and I'm saying it another time, yet there's so many layers to that, right? I think that there's awareness and increase in diagnoses in a, well, I was about to say in a positive way, yet we could see this as positive and negative. However, awareness, I think, is huge in general. So that's one. And if we, let's, because there's so many reasons, let's kind of delve into, because of your topic. When we talk about the environment, what I'm like, how do I summarize, or how do I sort of narrow this in? Deep. However, it's like a couple of things. One, I think about industrialization, right? And I think about all that in such a positive way, all these transformations in the products that we have, whether it be skincare to foods and preservatives. And I probably shouldn't say that they're wonderful, yet we've got all these parts that are moving us forward in terms of becoming more and more sorry, I'm not finding my words properly yet. More and more current, right? Yet I think about pregnancy. So I think about my grandma to my mom's internal health to then my internal health. And that whole path, whether it be nutrients, whether it be genetics, and enzymes that are turned on or off through that whole pathway, I think is a really big part of, as we get more and more exposure, that those things change. Nutrients in soil decreases. We have more toxins that are in toys, for example, to foods, to sippy cups that we drink out of. All of that exposure has increased over time, just as much as it's been passed down through us, just as much as we're reducing nutrients in soil that we're growing our food in. So, I mean, I feel like I could go on and on about this. And I often talk to patients about this and find myself getting really passionate about all these different aspects of where this comes from. And then also, also being like, whew, we need to take a step back. This is not going anywhere, really. I love some of the things that are happening in this world in general, our awareness of plastics, our awareness of BPA, phthalates, etc. And so that's amazing. So I shouldn't say it's not going anywhere yet. It's like we also can work within parameters to then not get so stressed out that we're literally not letting our children outside, right?
Right. Yeah. Stress is a toxin as well, right? It can be completely inflammatory.
Yes.
Yeah.
Yes.
Yeah. Well, would it, maybe I'll be specific. Let's talk about, say, heavy metals. Talked about plastics. In terms of heavy metals, what role does that play in something like the development of autism in a child?
Okay. So I love this. Now I'm like, ooh, where do I, there's so much to talk about. However, I like the direction here.
Yeah.
And so think about mercury, or think about aluminum, let's say. And what can happen is that that is a substance that can travel into the brain across the blood-brain barrier. Through the nasal cavity, for example. And so it can get into the brain and directly cause that neuroinflammatory picture, meaning you're going to affect neurons, you're going to affect neurotransmitters, etc. Then what you're also looking at is oftentimes, not always, in patients with autism, they have a hard time eliminating they have a hard time in their system to eliminate, not only because they're children and they have those immature guts and livers, yet also because of genetics that cause different enzymes to work properly or not. And so oftentimes you'll see they're called SNPs in those detox pathways. They're not working properly. So then you're not able to eliminate it. Mercury, aluminum, those are heavy metals, can affect, I'm trying to think, like processes in our body, such as methylation. Methylation runs over 400 different enzymes in our body, whether it be building neurotransmitters, helping detox our body, and so metals can literally bind into that methylation process and make it not work properly. Metals can also get into our mitochondria, or I should say more like the mitochondrial process of building energy in each one of our cells. This takes me back to also grade 7 biology of looking at those
drawing the little mitochondria in the cell.
And the production of ATP and the Krebs cycle. Anyways, so heavy metals can come into that process and make the obviously the mitochondria not function properly either. So there is a lot of and in a patient with autism, oftentimes they're already having issues in those areas. So not detoxing, methylation getting affected, mitochondrial function getting affected, directly increasing or causing neuroinflammation in the brain. So those are lots of that's a lot going on in that little system when there's exposure, right?
Yeah. And is that so that kind of mechanism where the heavy metal comes into all these different processes, would that be similar to other toxins as well, things like pesticides, herbicides, or are the metals kind of the only things that can do that?
No, that's a great question. And you would, for example, glyphosate, I feel like is another big topic.
Yeah.
More so, I think even in the US yet. One piece I actually didn't mention for metals, or some heavy metals, I should say. Glyphosate's another toxin, like we're talking about, yet that one has a major effect on the gut lining, causing inflammation, the gut microbiome, and therefore causing not only a reduction in positive bacteria, yet also then increasing that negative that then can then affect the brain. So you're then therefore not eliminating it. You're getting rid of the positive bacteria. And that combination can be so, again, neuroinflammatory. So what I would say is that I'm actually referring to that whole process with metals as much as glyphosate, yet they can work differently in that one would cause more mitochondrial dysfunction versus glyphosates, and the next child would be the issue in the gut, for example.
Right. Yeah, that makes sense. And in your clinical practice, I mean, when you're working with patients to maybe support detoxification or drainage, do you see like improvements in their quality of life and their ability to thrive? Like, what have you seen, and how do you do that? How do you help people on the spectrum when they can't necessarily drain and detox like someone else would?
Yeah. So I mean, I'm wanting to think of like an individual and a whole situation, yet you can't, right? Like there's so many, there's everybody's so different. However, when I think in general with toxicity in patients with autism or ADHD, you want those routes of elimination to be working properly. So kidneys, liver, digestion. So we really want to make sure that we are able to open those emunctories or those drainage pathways, those elimination pathways, first of all, and then alongside of let's say detoxing metals, for example,
Mm-hmm.
and pulling those from the system. We want to balance that out, that pull, along with supporting the system with different cofactors that can, or different nutrients that have been depleted by that whole presence of the toxicity in the body. So it's like really balance. It's like oftentimes I'll start with opening systems to allow all of that to drain or to eliminate, and coincidingly also supporting the body with nutrients because it's been so depleted. And then you start to then really pull, whether it be the glyphosate, whether it be the mold, whether it be heavy metals, etc.
Mm-hmm.
And so I guess the second part, you say, how do you do that? And that's how I do that. And it is the more and more, I feel like, and I think this is with every single profession out there, right? You learn in theory, and then you jump into clinic, and it's maybe not a totally different ball game yet. There's so much more that you learn from just seeing and doing, right? And the more that I see clinically, and I think maybe that's why I just get so much more excited every single day to work in this field, is because the more that I see, while I treat, by doing exactly what I'm doing, supporting and repleting the deficiencies alongside of getting rid of whatever toxins are present. You see these children come to light. And what's interesting, and I say actually come to light, yet almost sort of gain a presence in their body and then emanate the light. Because oftentimes kids with children with ADHD, children with autism, there is such a vibrancy and light in them already. So I shouldn't say they will come to light. It's that they're like, oh, okay, I'm here. I'm in my body. I'm now verbally communicating, or I'm now making eye contact, or I now have the ability to like be in my body instead of just poke and try and ground myself and really bother a bunch of other people or disrupt class, for example. So it's really fascinating when you see what we learn, theoretically, and applying it into clinic. You see those kids really shift in their life, right?
That's beautiful. I think it's really hopeful for families, maybe any moms who are listening. Let's be honest, I think it's mostly moms who are listening to my podcast, and my husband. But what would you say, like, to piggyback on that, what would you want to say to a family who feels maybe hopeless and like they're just really struggling, and don't know where to go, don't know what to say? Obviously, they could book an appointment with you if they're in the area, but what kind of message would you want to share with them?
I mean, a few things in terms of where to just gain, and that's hard, because what we do as humans in general when our children are suffering is dig in and pull at anything, right? And including me, right? So I think that, and this is tough, because it's like, I think it's like taking a step back and finding a person or a set of persons, whether it be practitioners, whether it be mums groups. I can't believe, I'm going to digress for 1 second here. I cannot believe how much I know on one hand, social media, internet in general, Dr. Google, like you can go down rabbit holes, you can find just a bunch of junk, excuse my being straightforward.
No, it's
However, on the opposite side, or just as much, you can find support groups in those areas with, children with ADHD, children with autism, and really find such incredible information from other families with things that work, right? So, sorry, I digressed there for 1 second. However, it's like finding those sort of aspects of where you can go for support, and then sticking to a sort of select few where you can be like, okay, I've done my research. What do you trusted practitioner, what do you think? Okay, I've what's the next step here? Instead of going like this and everywhere, it's like being sort of doing consecutive steps, such that then you feel like, okay, I know this is working for XYZ child, this is not, and then we move forward. And I think if you can find a team or a person, and whether that be practitioners, mom groups, etc., that can help you along the way, as opposed to just sort of being all over the place, because the overwhelm is huge. And so that's one thing. And then specific to toxicity and how that relates to those diagnoses, to really do the research and understand and find your people who can help you do that. And then, similar to what you just said earlier, Josie, with that stress being a toxin as well, it's the balance between, oh my gosh, I know all these things. Exposure to XYZ is not great for XYZ patient or child. I'm so scared. I'm not going to get them to eat or drink or go to a place or wear this clothing, et cetera, versus, oh my gosh, I'm going to let them wear XYZ clothing. Or, you know what, they had a bite of that. Oh my gosh, they shouldn't have. However, you know what, they're going to be okay. And that finding that balance, and it's going to be different at different parts of their life, at different parts of your stress levels, at different parts of like your whole journey with your child, yet really being able to understand that that stress is also hard, not a good thing on the entire family or the child itself. So that's a long answer of two things. One, find your people. Find your people that you can help to build a structured plan. And two, like, balance the understanding that you've gotten and the knowledge that you've gotten with the stress, and make sure that that is sort of into perspective a little bit, which will ebb and flow along the way.
That's really beautiful. I like the idea of ebbing and flowing, because in some seasons you might have more capacity to, live out lower
Totally.
toxicity in every area. And in some seasons you have to kind of let some things go. And
Totally.
yeah, so
That's
good.
I very much agree with that. It's life, right?
Yeah.
And there's so many layers. There's other siblings, there's work, there's running a household, there's other relationships, right? There's and for the child too, there's just lots of different things going on. So yes, I think there's lots of the ebb and flow, and to make sure that we go with it. Yeah.
Yeah, beautiful. Well, Dr. Hillary, if people want to learn more about kind of the link between autism and toxicity, do you have any resources for them, books that you'd recommend, anything like that?
Oh my goodness. So, gosh, you know what? Maybe I should send you a good list of
Yeah,
books that I
I'll put them in
I
the
love.
show notes. Yeah.
Okay. Okay,
Yeah.
great. Yes.
And then how people
And
find you, how people stay in
and
touch with you, learn from you.
yes, and then a couple of pieces that I really love, that I will learn from too, actually, sometimes. And the reason why I say this is because they have, so Doctor, gosh, I think, oh, you know what? I better send you this too.
Okay.
However, I think it's like dranow.com, or it's Dr. Paul Anderson. And he's a gentleman who's a naturopath who down in the States. So, and is just full, like just a wealth of information. It's incredible. And whether it be toxicity, or autism and ADHD specifically, yet that sort of a whole umbrella of toxicity. He is a wealth of information, and you find him on YouTube. He has this YouTube channel that you can look up a topic and then learn from him in like sort of small snippets of like 10 minutes to 20 minutes. There's another woman that I just think so incredibly highly of. Her name's Dr. Sonia Doherty, and she and her sister work a lot with neurodivergence, pandas, autism, ADHD, etc. And she has a couple of webinars that I really like too, and I feel like parents would learn from those quite a bit.
Awesome.
And then and then myself. I mean, I'm in Calgary, Alberta. I support lots of families around Alberta. And then of course I'm happy to put my information down as well.
Awesome.
Yeah.
Thank you. Thanks for chatting.
Those books.
Yeah, that sounds great. I'll throw them in there. And yeah, super appreciate your time and your wisdom and your passion. It's clearly a passion for you. It oozes out of you.
Yeah. Well, no, I'm and it's funny you say that, and I mean, I appreciate it. It's what I feel. And so I just love talking about this topic. So thank you so much for having me, and I'm happy this all worked out.
Yeah, thank you.